Okay, so the Health Co-Management Secretariat, we are the admin body for the structure. There's myself and Deborah Loy. I'm from Siksika Nation. I'm the coordinator, and my email and my direct line is right there. And then Deborah is the admin assistant, and her email and direct line is right there. So the Secretariat office is housed under Treaty 8. It commences in 2022, and then we move to Treaty 7. So it alternates between the 3 treaty areas every 5 years. So the history of the Health Co-Management Agreement, November 18th, 96, the Co-Management Agreement was signed by the Treaty 7 chiefs, the Treaty 8 chiefs, Alexis First Nation, which is from Treaty 6, and the Federal Minister of Health. The Yellowhead Tribal Council, Enoch Cree Nation, and Louis Bull joined co-management in 1999 and 2010, respectively. With the agreement, the Chiefs and Health Canada agreed to a 2-tiered process. Tier 1 is the admin process to co-manage the budget and programs of FNIB Alberta region, which is formalized by the agreement. Tier 2 is the bilateral process of the respective treaty areas and does not form part of this agreement. With the agreement, the Chiefs and Health Canada agreed to a 2-tiered approach. In the HCOM agreement, the Chiefs and Health Canada agreed to the following: co-manage the FNIB Alberta regional funding envelope, reallocate funding efficiencies towards health programs in Treaty 6, 7, and 8, increase the participation of First Nations in assessing, analyzing, planning, and managing programs and services funded and offered by the FNIB Alberta region. They will make decisions related to conduct and resourcing of the program and service delivery, regional resource allocation, and common health issues. So these are our principles: equity, fairness, transparency, accountability to programs, timeliness, appropriateness, and legality. And so this is our structure. So we get our directive from the Assembly of Treaty Chiefs. It goes to the HCOM committee, and then we have the Secretariat, which is the admin body, and the co-chair committee, and then there's the 6 subcommittees underneath, and they each have their own responsibility for different programs, health programs. So First Nations are seeking increased participation in decision-making, guarding the funding envelope to ensure that health funds were not reduced. Early successes for health co-management include changing attitudes. Budget information is shared with First Nations. Programs excelled in adopting a partnership approach. For example, home care, Aboriginal Head Start on Reserve. Increased ability for First Nations to bring forth concerns and participate in issue resolution. Better dissemination of information to First Nation communities. Better understanding of government policies for First Nations. Capital costs for programs without built-in funding, such as NADAP and ASOI. The current focus of HCOM is manage the on-reserve health programs and services. So I'd like to hand it over to Natalie, and she'll go through the subcommittee's responsibility programs.
Good morning, everyone. So there are 6 subcommittees as Erin outlined earlier. So I'll give a quick overview of them. The first one is Children and Youth Subcommittee, co-chaired by our colleague from Treaty Number 7 and Blood Tribe, Bruce Aaron Shirt. I've been co-chairing it for the last few months. It's normally co-chaired by other colleagues. The key programs overseen by this subcommittee are Aboriginal Head Start on Reserve, the Canada Prenatal Nutrition Program, Fetal Alcohol Spectrum Disorder, and Maternal Child Health. The Operations and Support Subcommittee is co-chaired by Tyler White from Siksika Nation and Brent Henry. That subcommittee has a number and probably a fairly diversified group of programs that it oversees, including the Accreditation, Aboriginal Health Human Resources Initiative, Capital and Facility Management, eHealth. It's used to oversee the Old Health Careers Program, Health Consultation and Liaison, Health Services Integration Fund, which is really the innovative side of the work we try to do, and Health Planning and Management, which is funding that goes to all the nations to provide some of the management capacity. The next two subcommittees are health protection. So that's co-chaired by Colleen McDonald from Inuit Cree Nation with Dr. Parminder Tierra. This has been a subcommittee that is involved with communicable disease control, bloodborne pathogen and sexually transmitted infection, tuberculosis control, and environmental health. And then the next subcommittee is mental health and addictions, co-chaired by Shannon Doubleday and Andy Luke from Big Stone Cree Nation. The programs overseen by this group is now mental wellness is pretty much an overarching program, but it includes the programs that were usually defined as Brighter Futures, Building Healthy Communities, Canada Drug Strategy, the National Aboriginal Youth Suicide Prevention Strategy, so that's NASP, National Anti-Drug Strategy, the National Native Alcohol and Drug Abuse Program, also known probably more by its acronym NADAP, the Youth Solvent Abuse Program, so YSAP, and the Indian Residential School Support Program, which is also known by its acronym RRS. The next, and certainly not the least, subcommittees are non-insured health benefits, co-chaired by Cash Shade from the Blood Tribe and Jack Candy, our Director of Non-Insured Health Benefits. And so what they oversee is really what are the non-insured health benefits: dental services, medical transportation, mental health, pharmacy and vision, as well as medical supply and equipment. And then last but not least the prevention program subcommittee, co-chaired by Calvin Badger from Sucker Creek, Cree Nation, with myself acting more recently. So the programs overseen by this group is the Aboriginal Diabetes Initiative, the Community Health Representatives, Home and Community Care, Injury Prevention, Nursing, and Nutrition. And I'm getting the pleasure to present a bit of the HCOM Secretariat. Clearly, every question on the Secretariat should go to Erin concerning her lead role. But the Secretariat supports the work of HCOM, the Health Co-Management Committee, and its subcommittee was established as an independent organization through an agreement with Treaty 8 First Nations of Alberta. HCOM provides administrative support and the following key activities. It's responsible for organizing the committee and the subcommittee's meeting, including agenda, briefings, and meeting summaries. It ensures that internal processes function well, including necessary templates, procedures, and protocols. It implements the co-management communication strategy, and it facilitates a liaison with external stakeholders and provide training to members as required. What you have here is a quick high-level timelines and clearly unreadable on such a screen. So glad that we are sharing the graph with you, but it highlights really the key dates along the work we've done together for the last really 25 years since the agreement was signed. The next slide will identify some of the key dates in terms of reviews. Co-management is more or less reviewed every 5 years. And it's really a way for us to assess if it's doing what it requires to do. This timeline of events give a fair amount of context to the work we do. I'm afraid I cannot read it either, but can certainly provide information on any of the dates if people are looking for something more particular. If you don't mind, Erin, if you can just go to the next slide, and I'll just talk a bit about the evaluation pieces, because I think that's what it is. So the reviews are, the first review was in 2001, 2002. And really that first review was really about what's the purpose of co-management and is it meeting it? So the answer at that time was that the extent co-management has found success in co-managing resources and program planning for First Nations in Alberta. In 2007, we undertook another review based on a Chief's Assembly request. That one, I would say the best way to describe it was an administrative review of what is an administrative agreement, that is the co-management agreement. In 2010, we had done an evaluation of the 2007 implementation, the implementation of the 2007 recommendation. And so we had some were clearly in advice completed, but some were also as ongoing. We had an evaluation done in 2015, and there are further discussions in terms of governance and partnership in terms of HCOM and the future that began really in 2019 and took a bit of a reprieve with the pandemic, but really an ongoing discussion as to how best to work within the co-management structure or beyond. Is it now that we are a department as Indigenous Services Canada, is it time to look beyond that? These are all the questions that individuals will be asking, or do we remain a health table? So these are the type of questions that have been circulating since 2019. And that led to the governance and partnership session that you can see was just a few months before the pandemic. We had a meeting, discussions were how to move forward in development of a regional health governance process, identify the history of HCOM and what successes had been achieved, and that timeline was a key element. And that there needs to be there is agreement on the partnership table. There's discussion as to how best to meet those needs from the three treaty areas. And I think that brings us to the question. So that is really indeed a quick overview of HCOM 101 for everyone. So really pleased to open the floor for questions.
Thank you so much, Natalie. Sorry, my apologies. At this time, we will open it up for questions. You can either put it in the chat box, or if you'd like to take yourself off mute, or if you have any comments.
I think we have a question from Jennifer. Jennifer, do you want to come off mute?
Yeah. Hi, I'm Jennifer Manduhano. I am the manager of capital with ISC-RO, Alberta region. And we had the HCOM presentation to my group, to community infrastructure, back in 2019. And of course, I'm particularly interested in the operations subcommittee. Is there terms of reference that could be shared in particular to the subcommittee?
There are terms of reference for both HCOM and the subcommittees. They are available through Erin's office in terms of access. They've been, I would say, they haven't been touched in a little while, so they need to be reviewed, but there are definitely terms of reference.
Okay, and could they be shared?
Yeah, they can be shared. You just have to reach out to Erin.
Okay, perfect. Thank you so much.
Hi, Jennifer. I'll send you my email contact, and then I can send them to you.
Okay, thanks so much.
Thanks, Jennifer, for the question. Natalie, just wondering to add to that, with the HCOM website, if I think there's additional information if people want to follow up there. I don't know if the terms of reference are on there, but just maybe I'll put the website in the chat box for everyone as well.
And the best person to tell you what is currently on the website is Erin.
Maybe just a comment from my end on HCOM, since I've been on it since 1998. So 2 years after it was formed and they started to have the committees and all that. It's just exciting to see the evolution of HCOM from just coming to the table and saying, this is what we're doing as a government, this is what you need to consider, to an increasing transparency, at least from my perspective, where the government was putting on the table lots of information, and then moving further from just transparency to indeed going and exercising partnership. And the partnership was an important step forward for years, until we have now transformation. And with transformation, really what used to be called, quote, the Indian health policy, unquote, in its original goal. The original goal was that communities would be self-determining and they would take control of their health services. Well, I am pleased, at least in my lifetime with HCOM, to see more and more of that control being exercised, more and more of the decisions made by the vast majority of members on the subcommittees, who are all First Nations except for one or two individuals who support, like the co-chair. One of the co-chair is from the program area. And then the technicians are invited from the government to provide data, evidence, etc. But the membership of the committees is vast majority First Nation individuals, representatives of all the treaty areas. So all this to say, I have seen the progression of the HCOM process, which is unlike any process, other process anywhere else in Canada. And many times when we were in national meetings anywhere, people always wondered, how is that HCOM working in Alberta? Because they heard about it and they didn't have any similar bodies where there are joint tables. Of course, in more recent years, things started to develop a bit more. And that's why you have the First Nation Health Authority in BC, for example. I'm grateful to and gratified to see the progress that has happened over the years with health co-management.
And maybe if you don't mind, Dr. Yacoub, just building on what you just said. So typically membership on all the subcommittees and co-management is 2 representatives from per treaty area and 2 FINIB representatives. So that's the membership, which is therefore 6 individuals from First Nations and then 2 from FINIB. The other piece in terms of Wadea is correct that we have the longest standing table. One that would be similar and much more recent is the one in Atlantic, where there is also a co-management table.
Thank you, Dr. Yacoub and Natalie, for providing the additional context. Is there any other questions or anyone like to come off mute? Maybe while we're waiting for people to gather their thoughts. Just wondering, during the time of COVID, actually 2 questions. If the discussions have been continued and just kind of to see how that's going kind of in the current environment that we're in. And then secondly, if you can provide any examples for how Alberta Health Services might have been connected or done anything with any of the various co-management tables. Maybe just 2 questions kind of relating to those 2 areas.
Okay. So to answer the first part of the question, there was in the early days of a pandemic a more quiet work around the co-management tables. I think that the first after the first 6 months from March to September 2020, there were a few meetings in that period of time. Since then, we have resumed. We are connecting virtually for our meetings, whether it be the co-management committee or the subcommittees. We have had regular meetings, probably a bit more frequent. They also tend to be shorter in length as a result of really how long can we stare at the screen is increasingly an issue. So co-management has been very brave and keeping to their day and a half. Subcommittees have traditionally been a lot more half a day, but more frequent rather than quarterly. So that would be that part. In terms of the participation of provincial partners, and Nadine, you would have seen some of that over the years, it's a bit of a pendulum, right? So there was times where there would have been presentation from Alberta Health Services to some subcommittees or even to the co-management committee where it was for a while almost a standing item. And then there was a bit of a pendulum back indicating that this is a First Nations federal table and not a trilateral table. So I think it's really acknowledging what is the desire of First Nations partners and how they want to work through this process. We've had for a while, and some of you would know quite well that as well, is the work we had done on the Joint Action Health Plan, which this one was a multi-party table that included First Nations from 3, 6, 7, and 8, Alberta Health Services, and FINIB. So over the years, there's different things, and that was and attached in some ways to co-management, but was not part of the formal structure. So we've done different things over the years in terms of connecting with each other. The health system is complex, and the need to have ongoing discussions with all partners is always key. And Erin, please feel free to weigh in if you need to add anything, or if you feel that I'm not displaying the information properly.
No, I think you explained it very well. Thanks, Natalie.
Thank you. Additional questions, comments?
Maybe I'll ask a quick question. It's Carol Brzezicki. How has your whole process changed? Because I know as the Indigenous Wellness Corps, a lot of our processes changed as a result of the response to COVID. Could you give us some examples of over this past year and a half, how things have changed?
I think I'm not sure that the processes per se have changed. What I think has changed is because we are still making financial decisions together. So maybe let me start there. As through the co-management table, we have over the years really done joint financial decision making. We do it at different levels. We do it as new funds become available. We've done it also in a planning way with what we call the MOP, which is the Management Operational Plan, which is a way for FINIB Alberta to secure resources from FINIB HQ. And so each of the subcommittees has an ability to weigh in on the funds, and then we submit that plan to HQ, and then we access the resources. And that plan, we were the first region in the country, and really going to what Wadea was saying earlier, in terms of having the same document shared with our deputy ministers as we had with First Nations partners, right? Everything in terms of the funding and how we access it is shared with everyone. So we've always done that. What was different, I think, with the pandemic is some of the funding that had typically been targeted for special projects or activities, that funding has been reprofiled to allow to support COVID response. And the funding linked to the Indigenous Community Support Fund has not gone through the co-management structure. This is funding that comes to ISK Alberta, and that has been left a bit aside. It's been allocated differently. So there has been a bit of change, but the changes have been about flexibility and the ability to be nimble during a pandemic. But when I look at funds coming down through what we expect 2020, what was announced in 2021 budget, we are really looking at how do we engage with partners in securing those funds. We are using really that structure to engage and to meaningfully engage. And I think that when Wadea talked about how it has changed over time, I remember and where the subcommittees used to have only one chair, and there was only at that back in when I joined FINIB in 0304, there was only one subcommittee that had a chair that was not FINIB, and it was the NADAP partnership table. And really coming from the 07-08 evaluation, that's when we established the process. That's when we established the HCOM Secretariat, but that's also when we established co-chair system, where every subcommittee as a First Nations and a FINIB co-chair, and we work in tandem. So that has led to quite a different, I think that has fundamentally changed how we work together in a much better way, but like it has been a fundamental change. So I gave you both the short-term answer, Carol, and a bit of the longer-term historical piece, if that's helpful.
Oh, it is. I know we're beginning to discuss, starting to talk about lessons learned over the pandemic and what is different. What do we keep? What do we go back to? And what do we want to, like what this new world would look like, right? And so I really appreciate that, Natalie. Thank you.
So another question, Natalie, if you could speak to, and Aaron, the First Nations that are a part of co-management, there have been some changes over the years for who is a part of co-management. If you could maybe speak to that to just give a bit more of awareness for the composition of First Nations amongst the treaty areas, as well as how you work with the communities that are not formally a part of health co-management.
Sure. You could take that one on, Nadine. Co-management, as Aaron outlined, was established in 1996. At that point, the chiefs from Treaty 7, Treaty 8 signed. For Treaty 6, only one chief had signed. So that was Chief Rod Alexis from Alexis First Nation. Alexis Nakoda First Nations. In 1999, the other nations within Yellowhead Tribal Council joined co-management. And at that point, Yellowhead Tribal Council included Enoch Cree Nation. And that's why you see Enoch's identified separately, as Enoch has withdrawn from Yellowhead Tribal Council a few years ago. And the membership was relatively stable from 1999 to 2010, when the 4 bands of Masquatchis joined. And then they withdrew a couple of years ago, and only Webull Tribe retained membership within HCOM. So what it means in terms of HCOM today is the nations from Treaty 7 and Treaty 8 are members of HCOM. And in Treaty 6, what you have is Yellowhead Tribal Council, Webull Tribe, and Enoch Cree Nation. The other nations within Treaty 6 are not official members of co-management. They can at any time attend meetings of the subcommittees and the co-management committee as well, and they often do, whether it comes from the nations or whether it comes from the tribal councils, or which are tribal chief ventures and Masquatchis Cree Tribal Council, or whether they come from the Conference of Treaty 6. Their funding is allocated, is not allocated based on HCOM membership. Funding is allocated based, if it goes to all nations in Alberta, it goes to all nations Alberta, and then they will use different funding formula. Many of them are linked to population and remoteness. We often call it the Berger modified. Others have been used. Some cases we have flat funding formula, 5,000. I'm thinking for BBPSTI, Wadea, 5,000 for the smaller nation, 10,000 for the larger. So there has always been consideration, and the funding has flown to all nations in the province, but not all nations have the membership to the subcommittee. So it's 2 different things, because FNIB holds accountability towards all First Nations in Alberta and not just signatories to co-management. Aaron, anything that you would like to add?
Yeah, I'd just like to add that when I do coordinate meetings for the HCOM committee or subcommittees, I always include the other Treaty 6 nations, their point of contact, which is Tina, and then she distributes it out. So they're always included on our meetings. I do see their attendance when they do join. And their participation is really it's sorry, I have my baby with me. Their participation is welcomed. Thanks. Sorry.
No, thank you. That's nice to have little ones in the background, but it keeps you busy for sure. No worries with that. Any other questions or comments from anyone on the call today? Okay, hearing none. Would just really like to thank our partners from the Indigenous Services Canada for sharing the update for the Health Co-Management 101. I think it's something that it's good to stay connected on and refreshed, because as you said, things kind of change on the pendulum. New things are happening with the communities, and so it's always nice to kind of get that update. So yeah, and there's some comments that we love to hear the babies in the background. So don't never ever apologize for our babies that are speaking to us. So we really, really enjoy that and appreciate that. So the next portion of this session, we are very honored to have Dr. Yacoub with us today, and just give honor and thanks from the partnership that we have with Alberta Health Services and the Indigenous Wellness Corps. We've worked very closely with you for a number of years, and so hearing of your retirement, we just wanted to give special honor with everybody that's here with you with us today for all the incredible hard work that you've done for our First Nations people, for our communities, for Alberta Health Services, for Indigenous Services Canada, and so we're very honored and thankful for that. And so we have a little mini program that we're going to turn it over to. So actually, Cheryl Sapegaham, who is a dear friend and an incredibly talented First Nation musician, the Aswani. Oh, now Cheryl, I forget. Your
It's
Asani.
Asani. Yeah.
My apologies. It's been a while, but she has done performances all around the world for the Queen, during our Olympics. So we're very honored. She is a former team member within the Indigenous Wellness Corps as well. And she's going to start us off with a song or two. Cheryl, if you'd like to open this portion of our session, and I'll take it away with a performance for everyone. And I hope I told Cheryl a little bit later, so hopefully she's still here. If not, we will catch her after we do the other portion. I know she said she was doing a little bit of stuff on the side in between. Oh, I think I hear you. Cheryl, are you there?
Yes, I am.
Okay, there we go. Welcome.
Thank you. I apologize. Are we ready for a song?
We are.
Okay.
And I said we got you a little bit earlier, so
Okay, I'm going to share a song of blessing. It's called I Want to Honor Our Children, in lieu of the news we heard, but also in recognition of Indigenous Peoples Day coming up next week. So this is the Children's Blessing song. It's a song a protection song, a blessing song to share with our children, to respect and honor and love and nurture our children.
Thank you so much, Cheryl, for that beautiful song. I think it's really very, very timely, very fitting. But also to Dr. Yacoub, when we were speaking just before, he was saying, you know, it's time to turn it over to the next generation. So blessings to you, Dr. Yacoub, as well as for the future generations for to follow in your footsteps. So again, thank you so very much, Cheryl, for the beautiful song. So
You're
then,
welcome.
oh yes, hi. So the next part, we are going to, I think, Jason, I'm not sure who's speaking, but we have a little, I think the Indigenous Services Canada put together a little presentation just to give you guys, for those that don't know, the amazing and incredibly hardworking and dedicated Dr. Yacoub, just to share a little bit more about him and his tireless commitment that he has done for our Indigenous communities. So maybe with that, I'll turn it over to, is it Jason? Are you the one that's going to be doing the speaking on the presentation? Or whoever from the team is?
I think I will do that.
Okay.
Yeah, they asked me.
Sounds good.
So I'm happy to, first I want to say thank you to Cheryl. This was very beautiful, very beautiful. It's an honor for me, since I haven't heard the drums for a while now, because we haven't been at meetings or anything where the drums were played. So thank you so much for this. So just it's interesting when you look back 23 years with First Nations. But maybe another comment I wanted to say about Cheryl's song. I don't know how many of you know, but before I joined Health Canada here in FNIB, I did work for what used to be the Edmonton Board of Health, which was the Capital Health, which was the Edmonton zone. So I worked for the province public health for the city of Edmonton for about 12 years. And my focus with them was on children and children's health. So I'm honored to hear a song that honors children. And yes, Erin, we're glad your child is here. So what do you say when you have worked 23 years? I'm trying to remember. So these are some of the glimpses of what happened over the last 23 years. It's not exhaustive, but it just reminds me a little bit of what kind of subject matters a medical officer of health deals with, and in particular, serving the First Nations in Alberta. So when it comes to Alberta Health, there were a whole variety of subject matters that came up through the years, certainly fish consumption advisories. I know Kathleen is on the call here today, Kathleen Gibson, who is a nutritionist, who also has a good, solid environmental health program. She supported the distribution, dissemination of information of these consumption once we received them, because lots of First Nations, of course, are near lakes and people consume a lot of fish. Chronic wasting disease is another entity that came up over the years, and the concern about prion disease and how we communicated with Alberta Health and with the First Nations around that topic of concern. And then, of course, most famously, the oil sands and Fort Chip cancer cluster investigation, which believe it or not, is still in the news since 2006. Once in a while, we hear something still about the concerns of the community and the incidence of disease. And kudos to Alberta Health Services, because the Cancer Bureau in Alberta Health Services, I'm not sure what the name of it now is, but it used to be called the Cancer Board many years ago, have kept Fort Chip up to date. They produce a report every 4 years or so that provides cancer incidence to the Fort Chip people in the region there. And then, of course, another effort that is joint with Alberta Health, but also with other partners, is the current effort for the largest outbreak we've seen of syphilis in the more recent years. In the last 3 years, we have seen numbers of syphilis cases like we hadn't seen for a long time, at least 10 previous years. And certainly the impact of congenital syphilis on the First Nation children, and the proportion of women who bore babies who were impacted by congenital syphilis. Next slide, please. And then there are emergencies that happen all and every single year. And thank God we live in Alberta, where there is strong partnerships between First Nations, and at the time we were Health Canada. We have the Alberta Emergency Management Agency, we have AHS, and we have the former INAC, and we certainly have Alberta Health, all of them working together with the First Nations. And I never thought I would say the first bullet, 2 pandemics. I thought H1N1 was sufficient. But 10 years later, we get on top of the COVID pandemic, which in a sense, relatively speaking, is a bit more demanding and had more impact on people in Canada, in the world, and in the First Nations than perhaps the H1N1 pandemic. And yet I remember very much having gone to each community, each First Nation, Ruth Richardson and myself, and then we had the folks from EMA going to each community to discuss their emergency plans and to discuss their pandemic plans and how ready they were. And we had began in 1999, following Dr. Karen Grimsrud giving us the heads up. We were at the Bernard Snell Auditorium in the University of Alberta when she announced to us that we need to prepare for an upcoming pandemic. Of course, the pandemic happened in 2009, 10 or 11 years later. But during that time, the amount of preparation was incredible in every nation. Of course, we are all aware of the wildfires. And again, these emergencies have a way of bringing the partners together to work together, because no one single group of people or organization can handle all these efforts. Slave Lake Fire, Fort McMurray Fire, even supporting Northern Saskatchewan communities who were evacuated from Northern Saskatchewan to Alberta, and where we, FNIB, along with all the other partners, including the Red Cross at the time, reached out to 700 plus people who had come to need shelter and care at the time. And certainly a lot of studies have happened with the University of Alberta and the First Nations and the Canadian Forestry Services on the impact of wildfire and evacuation on the First Nations. And all these can be easily Googled to review what the findings of these were. And of course, we will not forget the floods. The floods in southern Alberta had an impact in 2013, even previous to 2013 and after 2013, and how much working together has happened. Some of you may not have known Black Bear Crossing fires. There were a whole bunch of military barracks on Sutina Reserve that had caught fire. And when they caught fire, we discovered that there is asbestos that's being released in the air of these units. And it took a lot of work with the nation, with the military, with a whole bunch of public health people to ensure the safety of those people who were residing in those barracks, but also that the military needed to reconstruct some of these and build new housing, which actually happened, and it cost $50 million to build new houses for the community at the time. Then there were issues around the environment and the spewing of emissions from asphalt operations, and the working together to amend those concerns and to continue an operation, but in a safe manner towards the community membership, but also towards their neighbors. And most recently, we heard about the tech frontier environmental impact assessment, and tons of people from governments, including FNIB, working together to prepare submissions to the environmental task force that came to here. Of course, the end of that is that they withdrew, the Tech Frontier withdrew their proposal at the end of the day. Next slide, please. What happened inside FNIB over the years? Well, one of my early memories is Garth Corrigal, who used to be the regional director here, asking, why are we organized the way we are, and how should we restructure? And so he tasked Dr. Hodes, he tasked Heather Young, and he tasked me to work to restructure the region. And we basically decided, well, we are here as an organization to serve the public health needs of the First Nations living on reserve in Alberta. And so indeed, in 2001, Dr. Hodes called it the Yacoub Cube, because the shape of the organization was like a cube. I just remember the word because of Dr. Hodes, and those of you who knew Dr. Hodes, you knew that he liked to tease, to put a smile on everybody's face. And we organize in such a way that it's a memorable way for us. Of course, the organization was reviewed in 2017, and now we have a little bit of a different structure in FNIB, Alberta. We were also in Alberta the first region in Canada where the medical officer received designations under the Public Health Act. So Dr. David Strong and myself were the first medical officer of health serving First Nations because of the wisdom of the late Dr. John Waters, who was the chief medical officer of Alberta. He said, First Nation people living on reserve deserve equal protection under the law for public health. And that's why he allowed us to have the designation so we can intervene and deal with communicable diseases, with environmental issues, just like anywhere else in Alberta. I always learned that public health is not a Swiss cheese. It doesn't have holes anywhere in Canada. Public health is one body of health, and that is, it impacts public, whether you're on reserve, off reserve, it's the same impact you would have. And I always said, viruses do not know jurisdiction. They do not know, the bugs do not know borders. And so indeed, we work together on many occasions with Alberta Health Services on a variety of outbreaks. And then I was given the privilege of being the co-chair of the Health Protection Subcommittee in Health Co-Management. And I always enjoyed working with the First Nation co-chairs who happened to be either nurses in charge in the community or health directors. It's been a privilege. For 17 years, I was able to work together as a co-chair with communities. And certainly in variety of communities, there were not, it's not just the oil sands up north, there were many more cluster investigation. And I just mentioned an example here where a bunch of individuals in the community there developed colon cancer. And they were wondering, what is the exposure for that colon cancer? And we got the Public Health Agency field epidemiologist and the Alberta Cancer Program on board to investigate with us. And we were able to satisfy the information of the chief and council at the time, who were very concerned that this actually was a familial, one family that was suffering from a rare colon cancer that actually impacts family. It constitutes about 5% of colon cancers. And so interestingly, people wondered, was that related to natural gas? Was that related to any kind of exposure? But at the end of the day, we knew that it was a genetic disease because it was familial in this case. Next slide, please. Of course, STIs were stigmatized a long time ago. Nobody wanted to talk about STIs. hardly anyone wanted to talk about HIV, and we're talking the early 2000s. Even though these diseases have been around for millennia, and more recently, of course, in 1978, we heard about HIV, which became reportable in 1998 in Alberta. And so it was very important to start in Ottawa and have them hire a team of STI people. So we began that through the efforts of the Alberta region by impressing that this is a burden of disease that is very high and needs to be addressed. And from there, it also came to the region and the regions across Canada to start having a team of nurses focused on the prevention education related to STI. We certainly worked on the tuberculosis issue. For years, we worked together with the provincial colleagues and with the University of Alberta. Dr. Richard Long would come to mind for sure. And where we felt TB is being, like all the communities were brushed with the same brush. All of them must have TB. And I didn't believe that. And we did a systematic review, community by community. How much TB was happening? What is the BCG coverage, the vaccine that used to be administered there? And at the end of the studying and the working together with the stakeholders, we determined where we needed to focus our energies on tuberculosis and whether we needed to continue with the BCG or not. And we held gatherings in 7 sites across Alberta, and all the communities were invited to those 7 sites, and we provided them with the information that we were able to collect and review. And lo and behold, 40 out of the 44 nations at the time discontinued BCG. They didn't need to continue the BCG. There was only 4 communities remaining with the BCG. And certainly the most joyful year for me when we actually had 0 TB in First Nations on reserve, and that was 2017, when I told Grand Chief Willie Littlechild, because he was preparing a presentation to give at WHO, and he was talking about the problem of TB. I said, Chief, we have no cases of TB in 2017. That was the year he was going to give the talk. He couldn't believe it, and I provided him with the information. And so that was, of course, TB is still with us everywhere in the world, even in Canada. But the proportions among the Indigenous populations have come down, at least in Alberta here, from what it used to be. And I really believe that evidence-based work in public health, that is a most concrete example of checking the evidence to see why we're doing what we're doing in a program. And certainly introducing in our program a second TB nurse that focused on the discontinuation of BCG. And then we had some screening activities coming on board, which even that now we have discontinued because we're catching all the cases through the normal processes like off reserve. And so this is wonderful progress that I am always encouraged by when I think about the CDC in Alberta. Next slide, please. And of course, we had, from a communicable disease control point of view, tons of infections that we needed to deal with. One of the biggest was Shigellosis, which is an enteric disease. And it had started in a large community in Alberta and then spread to 8 other communities because it's a very contagious enteric disease, and it doesn't take a whole lot of bacteria to spread. It takes a small number of bacteria to spread. We also dealt with hepatitis A outbreaks, STI outbreaks that were happening both on reserve and off reserve. So that's where cross-jurisdictional work happened to be so important. I remember working, for example, on the Hep A outbreak with Dr. Paul Schnee, who was an MOH in the central north Alberta. And that was part of my learning too, by the way. I was learning how to work with my provincial colleagues as MOHs. Many times they felt well, that's our jurisdiction. And I said, that's a joint jurisdiction. And we built that collaborative relationship over the years. And certainly one of the things that I'm encouraged by is that we started reporting back to the communities, the CDC incidents, so infectious diseases that happen in the community, immunization covered that happen in the community, any environmental health issue, but also we did annual reports or every 2 years on a topic like diabetes and the impact of diabetes on the community. Cancer, there is a report that was done on cancer in First Nation. And furthermore, we continue to receive medical students, master's students, residents, public health residents, especially from universities across Canada that came to learn about Indigenous health in Alberta. Next slide, please. And I think that might be my last slide. I hope it is. Yes, it is. So again, one of the roles that I played is I was honored to be the representative of the FNIB medical officers on the Chief Medical Officers of Health for 2 years when they met across the country and came together, which gave me, and again, a bigger perspective, but it gave me an opportunity to put on the table Indigenous topics that they needed to think about and consider as Chief Medical Officers. I participated in the NACI working group on rabies. And that's always an interesting thing that is always evolving about rabies in Canada. And also opportunities for being the co-chair of the Communicable Disease Working Group nationally, as well as the Regional Medical Officers co-chair. So all this to say, I have had an incredible honor and privilege to serve the nations both at the local level, at the provincial level, at the national level. The job of a medical officer is never boring. You can see from the variety of topics that there is just, it's a good job for an attention deficit person because you change topic all the time and you have to deal with multiple things all the time. And certainly the pandemic in the last 2 years have cemented the relationships even further with the chiefs, with the counselors, with the community staff. We have been in touch with many chiefs and counselors and community staff and RCMP and everyone you can think of almost on a weekly basis given the COVID situation. So thank you folks for an incredible journey and an incredible opportunity. I consider myself that I've learned so much from the Indigenous culture. I have learned the respect for elders, clearly still around because we don't see that in the world today. I learned that opening in prayer is still honored in the First Nation context. It's not something that is done outside in many places. And I certainly learned listening. Medical officers or doctors in general think they know everything and forget it. They don't. They need to listen and listen well. So having said all that, thank you for the opportunity, for the honor. And I am just grateful for these years that I've had with you all.
Hi. Thank you so much, Dr. Yacoub.
Hi.
I think it's incredible because for over the years, you know, we've worked together on a number of those pieces, but when you put the collective and reflect upon all what you've been involved with for so many years, it's pretty incredible and astounding. And so, you know, it just, again, we are so thankful to have had you as such a wonderful partner throughout those years. And there's many thanks and praise for all your incredible work coming through on the chat session. So everyone's very appreciative. And we actually have a little bit of time. So I think Marty was going to share a few words, and then if there's anyone else that wants to share a few words, you know, we'll feel free to put up.
Yes, please do that as Marty is going to give a couple of words, but I would love to see you open them. I've got to leave in 10 minutes, and so I want to see that. Worse than a child, eh? Open it, open it, open it. Oh, here's Métis Sash.
The way of honoring in virtual way is a little bit different, but we're very glad that you were able to get this gift on behalf of the Indigenous Wellness Corps. Oh, beautiful.
Wow, nice color.
It is beautiful. Thank you. I just opened it for your information, and well, first, what an effort to bring it over to Canada Place. So thank you, Carol and company. When you employ family members to bring these things over, that's much appreciated, but it's so beautiful. Thank you so much. I just want to add one word, Nadine, and that is, of course, all the work was done through a team, and it's not just me, it was always the CDC staff, the environmental health staff. I just wanted to hit that note that we always work as a team in public health, as you know. But thank you.
Welcome. Yay, yay.
So nice. So Dr. Yacoub, when I heard that you're retiring, I thought, no way, get out of here. Who's going to replace you? All that kind of stuff, you know, things that go through your mind, right? But I just want to say thanks. I remember when I first met you way back in 2000, when I was with the Alberta Mental Health Board, and I was the coordinator for Aboriginal mental health. And somehow or another, I got connected to FNIB, and FNIB was doing an Aboriginal youth suicide conference. And you were there. You provided all the stats, right? And so we sat on this committee together. And I was fortunate enough to sit beside you at the very beginning, because I was just, I was a young whippersnapper in Aboriginal mental health back in the day. And I was really nervous, right? I was excited, but I was also very nervous. But what was interesting was at the meeting, you know, in the towers of Health Canada, at the board meeting or the boardroom, there was someone there that came on very strong, started talking about treaty right to health and things like that, right? And I started getting nervous. I was looking around. I wasn't necessarily nervous for myself, because I'm thinking he's directing this to everybody, right? And but he came on very strong, and I was looking around. I was thinking, because there's other people from other areas, right? It wasn't just FNIB or at the time Capital Health. I think it was, you know, a large group. And then I looked at you, and you looked so calm and comfortable. So I thought, okay, if you're calm and comfortable during this period, then I'll be okay. And ever since then, you know, working with the communities, certainly it's been a great experience working with communities, because they need to talk about the treaty right to health. They need to talk about access to services, and they need to talk about suicide prevention in a way that they need to. And if it's truth telling that makes people feel uncomfortable, then that's so important. And I learned your response. I took your response into my responses, and I realized, okay, this is really important. And I've learned to really be able to do that with each of the communities I work with throughout Alberta, right? So that was my first introduction to you, and your presentation was awesome. I liked your candor, your directness, because after you provided all the stats, you turned to the audience, and so you said, okay, now we have all this information. Now it's up to you. Take it to your communities, take it to your leadership, and plan from there. And I thought, wow, another great example, right? Communities are in need, but they're in need of information. They're in need of data, and they're also in need of being able to make their own decisions. So the earlier discussion about HCOM and the ability for HCOM to be more autonomous in terms of their funding is very significant and important, and that certainly was there too. So I want to thank you for your many years of service. I want to thank you for your support that you've given me throughout the years, in and out of back and forth from Alberta Health Services, you know, and every time I've come back, you've certainly welcomed me very warmly, and I appreciate that. And I've always seen you as a good champion and a good friend at FNIB. So whenever I sat next to you at committee meetings, it was always nice to be there. So I just wanted to add that. Thanks. Good luck in your retirement, and happy cuddles with the blanket. And now you have to learn how to jig.
Oh, I was exposed to jigging in 1985 in Toronto. There was a Métis jigging happening at a conference, and I was so delighted. That was my first exposure as a newcomer to Canada. I had been there 3 years, and I said to my wife at the time, "What?" She's the same wife I have still now, but I said to her at the time, "I love this music. I love this," not knowing anything about me joining that group one day and working with Indigenous people. But Marty, thank you for your kind words. I loved working with you. You have a calm spirit yourself, and it's always good to work with you, sit with you. I remember when I visited you near the Royal Alec building there, I can't remember what it's called, and meeting you in your office for the first time there, and you worked with us on suicide prevention, and you worked with us on all kinds of injury prevention things, which I didn't include in the list of things we did, but definitely that was one of the concerns I had at the time. The leading cause of death among First Nations at the time was indeed injuries. And so thank you very much. I am paddling.
Thank you.
Thank you, Dr. Yacoub and Marty. Is there anyone else that'd like to take themselves off mute, or if there's any additional greetings they'd like to share? There was a few people that had to leave. Dr. Yacoub just wanted to send you well wishes and many thanks for all that you've done. So if there's anyone else, we have a bit more time and you can take yourself off mute.
Yeah, it's Chelsea. So Dr. Yacoub, we've known each other for a long time. Yeah, I guess I'll take the whippersnapper aspect that Marty said, because I remember university and doing, during, the 4 months you have off, and I had a chance to work with FNIB and Health Canada and walking up the hill to Canada Place and just working with all the team players there that I know a lot have been there for a long time. So I remember that and going for dim sum at the restaurant across the street. I don't know if it's still there. It was really good dim sum. So that was a staple. So no, I just want to thank you for all the work. And it's been a long time, but definitely I know other people that have retired, but they haven't really retired. So I want to make sure you take that time, Dr. Yacoub. And I'm sure people might be knocking on your door in other aspects, but just want to thank you for all the hard work that you've done. And it's been a pleasure working with you throughout all these years in my health career at this point. So.
Thank you, Kelsey. Likewise, it's been a pleasure working with you and knowing everything that you're doing within AHS for the First Nations and in different roles that you have played. It's incredible to know years have passed by. I just don't understand how time flies. I now understand it a bit more. But the honeydew list is waiting for me. So I am off work for a little good period of time, at least between 6 months and a year, because I have so much work to do at home for my wife, who I promised I will do this when I retire. I'll do that when I retire. The list is posted in our home. Thank you.
I have to step away, Dr. Yacoub, and I just want to talk about your integrity, your honesty, the sense of not only calm that Marty talked about, but just the ability just to know that as an individual, just who you are. So I just want to just say, bless you, and I just pray strength over you. And what I appreciate about you is you're always, the gift that you've left me with is just this, just the ability to be reminded to be thankful. I know Nadine and I had a quite extensive conversation a couple of days ago, and we're talking about what we want to be known for, and whereas we're preparing for today. And so I just want to say to you, you've left me with just a reminder to be thankful and grateful at all times, and that you reminded me that everything changes. Time stands still for no man, right? And so I'm grateful for that. So I've taken that and just am reminded. I remind myself when I get frustrated that, nothing lasts forever. you know, everything, there's only a season for everything, right? And just to be grateful and thankful. So I just want to honor you for that and say thank you for that.
Thank you, Carol. Thank you. Thank you very much.
Thank you. And there's another comment in the chat box just saying you're so deserving of this honor and to enjoy. Connie Admoran said that she's enjoyed working with you for so many years and just very well wishes of happy retirement.
Thank you, Connie. Thank you very much.
Anyone else before we bring this to a close, this portion?
Now, please bring it to a close.
Well, until the next journey begins, just on behalf of everybody here at Dr. Yacoub, just many thanks and honors for being able to have touched us in the way that you have. Can't thank you enough. It's just been an absolute pleasure being in your presence whenever we have that gift of being able to be around you. So thank you so much. Just wanted to just send a quick reminder for those following the session. We do have a short survey. If you'd like to participate, we will be doing weekly draws of various beautiful items that have been donated by the Indigenous Wellness core team. The winners are announced during our highlights and closing prayer session. We also encourage you to continue to check the calendar of events as events continue to get added. Next week, we have a ton of events coming up. Many more have been added. So hopefully you can share the information with your colleagues, networks, internals, externals. Everybody's welcome to join. So we just encourage you to continue, and thank you again for being a part of the session. And once again, thank you so very much, Dr. Yacoub. Hi. Thank you very much. And there's another retirement session happening right away at 1 o'clock for Judith Hockney. So, and then another session after that. So feel free if you're able to continue joining us today. Hi. Thank you, everyone.
Hi. Thank you.